Good afternoon all.
Good afternoon.
We are going to have a group discussion on the topic of perfusion and also in complications. Okay. Each one will be given each topic and you can able to discuss the topic well. You just ask questions to someone, have a group discussion, and the marks will be given for the topic you selected and how you are presenting the topic and how you are interacting with it. Okay. So we are going to start first.
Okay, so hello everyone. My topic is partial cardiopulmonary bypass. So, what do you think about this topic? Anybody? What do you think that means?
Like partial, not complete.
Full bypass is minimal bypass.
Yeah.
Partially heart and lungs.
Like we are not going to do a full cardiopulmonary bypass here, but in a small, rather in a small way. So it is a technique where patient's blood flow is diverted from the heart. Okay, for instance, if the surgery is taking place in aorta, the blood is taken, the heart will be beating, and from the heart, the upper side of the body, that is the brain, and those organs will receive blood. Rather, the lower side of the body will receive blood from what we give. So, blood will be taken from right atrium, and then it will be given to the lower body by placing a cannula there. So, if we see the advantages here, what do you think? Like difference from full CPB, we are only going to do a partial CPB. So, what can be the advantages?
Reduce prolonged bypass time.
Yeah, bypass time will be reduced.
Avoidance of aortic cross clamp.
Yes, and also
Minimal risk of infection.
Ischemic injury.
Ischemic injury, reperfusion injury, those things are all reduced. And also, we are going to do only a partial CPB. The heart is going to beat, so there is no usage of chemical anesthesia. And also, there is no usage of hypothermia here also. Normothermic bypass, we can do this. Okay. So, and also there is a reduced ischemia and hemodynamic stability is also increased. And to see the indications, that is for aortic repairs, complex aortic surgeries, and also some congenital heart diseases, and also as a bridge to wean from the full CPB, we can use partial CPB. So if we see the disadvantages here, like to balance those flows, we have to give flow to the upper body also with the regular circulation, and we have to maintain the lower body circulation also. So balancing this will be a little difficult, and also technical limitations, that is usage of cannulas can be sometimes improper. So from those types the risk can be higher. So this is what partial CPB is.
Okay. So why not to go for an chamber surgeries with partial bypass?
Because opening of chamber is
Opening of chamber will have a high risk of cerebral aneurysm. That is the reason we are not going for an partial bypass. The main risk of going partial bypass is heart aneurysm, and sometimes you doesn't get a proper drainage from the patient. Why? Because of beating of the heart. Okay. Before going for a partial bypass, we will go for an cardiotomy bypass. What does that mean?
using only suction.
It's called as suction bypass or a cardiotomy bypass. We are doing only, we are taking the suction and we are running bypass. On time also the heart will be working and pumping. That is also comes under partial bypass. What is left heart bypass?
Only perfusing blood to the left side
Left
of the
side.
heart.
The perfusion will be taken by the left side of the heart. Okay. Any other questions that you want to ask me? Maybe?
Cannulation.
Annulation sites.
It will be right atrium. You take the deoxygenated blood from the right atrium and you give the blood back to the lower part of the aorta, because the surgery will be taking place in the aorta. We are just diverting the way from the regular circulation. We are just diverting.
So what is an ACT that we can give on this surgery? Any videos?
100 to 100 seconds.
But we are going to cannulate, so it will be
300
more than
seconds.
300 seconds. That was based upon the procedural duration. Okay. Next topic. Right.
Okay. Good afternoon, everyone. Today we are going to discuss about what are the things should be maintained by the maintenance perfusionist for the retrieval of organs, mainly focusing on lungs and heart. Do you have any idea about the retrieval of organs?
Yes, we go as a team and we will retrieve the heart or anything. And for heart, we use cardiopathy, CPB solution to arrest the heart and then we bring it back.
Okay. Uh, the the retrieval kit procedure follows upon the perfusionist. So basically, some common things should be present for both lungs and heart retrieval. Those are 1 ml syringe, 2 ml syringe, 10 ml syringe, 20 ml syringe, ABG syringe. Do you know what is the reason behind ABG syringe? We can use 1 ml or 2 ml syringe, but why we have a separate ABG syringe?
For ACT.
Because the ABG syringe is heparin coated. So the blood will be coagulated. We have time for checking the ABG status. Then we should have blade, sterile container, heparin, pH meter, gloves. We should have maintain and a separate dress for why we should have pH meter. Do you have any idea? In organ retrieval, we should have a pH meter.
To check the pH of the organ.
Yeah, because when you are going for about a lung retrieval, we should know whether the patient has an respiratory acidosis or alkalosis. The pH can be checked throughout the.
With the pH.
These are the common things should be present